Hello everyone, we are from Group 10 and today we will be presenting about depression and suicide. What is depression and what does it have to do with suicide? Depression is a serious condition that negatively affects how a person thinks, feels, and behaves. It is different from normal sadness. Clinical depression is persistent, often interferes with the person's ability to anticipate pleasure and functioning in daily life. So, a case study has been conducted in Malaysia, and it is found that depression is the most common mental illness, affecting approximately 2.3 million people, especially among young people. When depression is moderate or severe enough, it could lead to self harm, thoughts of suicide, or even worse, suicide attempts. Depression is known as an overwhelming state of negative emotions such as sadness, guilt, despair, hopelessness, irritability, anxiety, anger, and many more. So, how can these emotions affect one's perception and behavior? So, the first one is being negative towards themselves. The constant feeling of being worthless, guilt, and self doubt. It can also impact their self esteem, making them feel like they are inadequate. The second one is the pessimistic outlook. It distorts the person's view of their future, making it seem hopeless and full of failures. This will cause them to be unmotivated. The third one is fatigue and loss of interest. It affects their ability to stay engaged in any activities, which may lead to withdrawing from hobbies, social events, and responsibilities. What are the types of depression that we have? Everyone experiences depression differently. However, different types of depression have particular symptoms and may appear in different times. So we have major depression, chronic depression, bipolar disorder, seasonal depression, pregnancy-related disorder, psychotic depression, PMS depression, atypical depression, and situational depression. What causes depression? There are three main factors that causes depression. The first one is biological and psychological factors, such as genetics, brain chemistry, hormonal changes, and personality traits of a person. The second one is the environmental factors, which means a stressful and traumatic life events can maybe overwhelm a person's ability to cope, as it can create a persistent sense of fear and insecurity. Last but not least is the social isolation and loneliness. So the lack of support networks cause people with depression to believe that no one cares about them, which makes it hard for them to seek help or find encouragement.
Recognizing emotional signals of depression and suicide. Emotional cues. Emotional cues are signals that people use as clues, a way to express their intention, feelings, and thoughts. The clues may be conveyed through their body language, facial expression, tone of voice, and they may be communicated verbally or non-verbally. Verbal cues. Verbal cues are spoken words that convey a message, and it can be opinions or feelings. Verbal cues can be more clear and accurate. Since both written and spoken communication employ words to deliver their message, so they are related. Non-verbal and subtle sign. Most of time, non-verbal cues can be misinterpreted by everyone. Non-verbal cues include body posture, facial expression, gesture, and eye contact. For example, they may rub their face, pinch the bridge of their nose, or close their eyes. Addressing stigmas and opening out about emotion. First, misconception about emotion and depression. Emotion and depression is different, involve the range of symptoms. Depression is a serious mental health condition that more than just a feeling itself. A prevalent misunderstanding about depression is that it is just a sensation of melancholy or being down, although sorrow is a universal human emotion. Depression is much more than just sadness. On the other hand, depression is a chronic and crippling mental illness that translating emotions of sadness or loss. Breaking down stigma. Encourage others to seek out accurate information and mindful of their language. Inclusive language can help people feel seen and valued. Reducing the shame and loneliness that person with mental health disorder may feel is the first step in eliminating the stigma associated with mental health. In addition to making it challenging to seek therapy, stigma can cause emotion of helplessness, shame, and embarrassment. Managing emotion to help and prevent. First, recognizing and validating emotions. Small actions like asking about someone's day or validating their feelings help people feel heard, which can reduce isolation. So, recognizing and validating emotions involve acknowledging and accepting another person's feelings as real and valid. It doesn't mean you have to agree with their action or words. Self-management skills. It's important skills like mindfulness, reframing negative thoughts, and building resilience as part of managing one's own emotion. So, self-management skills important to who want to manage their emotion so they can create the ability to self-motivate and self-monitoring in order to do things individually or with others effectively. Seeking professional and community support. Emphasize that professional help and a supportive community offer guidance on managing difficult emotions in long term. So, having a community support has also been proven to reduce depression and suicide. Professional help also mentoring treatment for mental health issues can include medication and psychotherapy to improve the depression to be better in long term. Conclusion. To sum up, it's important to understanding the emotional landscape of depression, recognizing emotional signals, and practicing the emotional management to increase the risk of depression and suicide. By giving people the opportunity to express their feelings, it can provide relief from the negative feelings and suicide attempts. Inaction stigmas about depression remain major barrier from seeking help. Depression is a treatable condition and no one with it should be left behind without the help and care.